we've been spending the week talking about $500 billion in cuts to Medicare. So now we're talking about possibly expanding Medicare. At the same time, we're cutting $500 billion out of the care that Medicare patients would get.
What does the base of this bill do? It takes $464 billion out of Medicare to create a whole new entitlement.
But if you add 15 million new people to Medicare, what you're going to have is 50% of them aren't going to find a primary care physician to care for them.
The amazing thing about this proposal is that it takes a program that is destined to be bankrupt in a few short years, cuts $1 trillion out of it over 10 years when it's fully implemented, and then adds a whole millions of new people into that program. I mean, it's hard to come up with any rational explanation for what's going on here other than that they are left with just in desperation trying to throw something in the wall hoping that it will stick.
We keep hearing about these new iterations of this bill. It reminds me at the end of a football game trying to throw a Hail Mary pass. You know, just somehow, some way, find a way to pass this bill. Well, I think it's important for everybody to remember what happens to most Hail Marys. They fall to the ground incomplete.
We'll stay till New Year's Day. We'll stay to Valentine's Day because this is indeed a historic bill and we don't want to make a historic mistake.
So I'm supposed to go home to Arizona this weekend and say, my friends, we've been working on health care reform for a year, and guess what? I can tell you nothing. We need to stay in. We need to know what the proposals are. We need to have votes on it, and we need to tell the American people what's going on behind closed doors.